So we're doing the Profhilo treatment today, as we discussed. Okay. The Profhilo treatment is a great treatment. It has, as I said, it has a specific kind of hyaluronic acid, very high concentration, but it doesn't give a volume. It doesn't make the face bigger. So it really makes the face, it makes it a little bit more tensioned, it makes it more tight, and it rejuvenates the skin. And it doesn't have any downtime. We just have 5 injection points. So there's very little danger of bruising.
Why it's 5? Where do you inject? Is it like the lifting point?
Yes.
Okay.
Yeah, we have 5 lifting points.
So can I tell you, can you show me where are the lifting points here?
So what we do is we take 5 points. One point is here on the top. Another point is here on the ear. One here on the mandible. One under the mouth, corner of the mouth, and one at the corner of the ear. So we have of the nose. So we have 5 different points in 5 different compartments in each area. And you can imagine if these things come together, then you will have exactly the effects that we want.
So what about the upper part?
It is normally not used in the upper part. It can be used for skin rejuvenation, but in this area, it's not really that you need more. It doesn't have to come together. Here, we normally have the problem of wrinkles, which you treat better by Botox and some skin treatments. So we really don't want to lift that up that much. We do want to have some lifting effect, but the Profhilo also relies on the structure under it. Here you have skin, muscle, bone. Here you have fat, which you don't have so much here. So we really want to have a more, this is what we know helps a lot. Okay. And the neck is also a very good option, by the way. For the neck, yeah. Okay, you ready? Perfect. And then we're just injecting 0.2 ml. Very slowly.
Is it painful? No. Oh, I don't like needles.
I hear that all the time, but still people come here and do something.
Yes, of course.
But it's the same, you know.
No other option.
I don't like going to the gym also, but I have to. But really the great thing about what we talked about before, I think people want to avoid long downtimes and bruising and everything.
Yeah, because they work, because they have a lot of other commitments.
So a big part of what I'm doing here is also I always sort of try to follow up with my patients. I ask them if they're happy, I see if they have any bruising. We try to optimize if we can do something better in patients, for example, that have a tendency to bruise.
Do you advise them, let's talk before the treatment. Do you advise them to take any medication or any kind of like anti-bruising or anti-inflammation?
So ideally, yes. Yeah, ideally I want to do that, but to be honest,
what's the best one?
I believe in nature, so I would say the best treatment that we can do is arnica creams and arnica pills.
Yeah.
So if you do something major, I ask them to start this 2 or 3 days before the surgery, and sometimes even longer. If we're just talking about fillers, to be honest, most people don't prepare that much. Well, they come in, they have the treatment, they book it, and I want them to feel like they're not doing something major where they have to prepare. You know, you don't want to do a blood test before we do that, right? That was it. Yeah, this was one side. Huh? So in the end, she will now need a few hours until the swelling goes down. There's a tiny bit here, but in the end, nothing
Personally,
really.
I'm not seeing any bruising, but I'm sure you can see.
I really wouldn't expect any bruising at all. You can see this, like where the needle went in, there's a tiny bit of blood, but otherwise that's really it. And I would say that in half an hour, no one will see anything anymore. So one of the things that we always have to look for is symmetry, of course. Well, the one thing that people come back and say I'm not symmetric, but they don't realize that they were not symmetric before. And so it's always good to take a picture and to be able to get back to the patient and tell them, listen, this is how you were before and you're so much better now. It helps everybody. It avoids unhappy patients and it makes things to understand much better. I work a lot here with pictures. We do 3-dimensional modeling before. We have this chrysalix system where we can do the noses and the breasts and everything, and that really helps to understand.
Do you advise the doctors or the patients to do this kind of like the chrysalix, for example? Do you think it will help them to understand what exactly will be the final result? Have you ever?
I know this is part of the Cosrx thing and it helps the patient, but in my opinion it helps me more because I can understand what the patient wants.
Okay.
We have talked about this before. Patient comes in and says, I want a natural look. I want a natural look. And then you try to create something natural, which is natural for you, but that might not be what the patient wants. I have one very big example in my mind where I had a patient who came for a breast lift and augmentation, and she was a mother and she was, I forgot, maybe in her late 30s or something. And she said, no, I'm married, I have my husband, and I want a natural look. And we did simulations, and I thought what would look natural, and she was, no, that's not what I want. And then she showed me some pictures what she thought was natural, which I would not think was natural. But in the end, that's why these Cosrx things work so well, because in the end I can show them this is what I think.
What's their needs.
And then the other thing I always tell the patient, like for example, if we briefly touched her nose before, I'm sorry to say that, but in the end she's spending so much more time with her nose, and it doesn't make sense to impose what I think is beautiful for her. She needs to know, is this what I want? And only if I understand what she thinks is beautiful, then I can try to model that result. So I think it helps a lot. I think it helps me understand what the patient wants. But it's really more important to avoid disappointments afterwards.
Yes, of course.
So we're done with your treatment.
How many percent is accurate? If you like,
To be honest, maybe 80%, not more.
but it's 80 is a good.
Oh, you mean how well I can simulate, or what is the result
for
will be?
example, the results. If you show them this is going to be, for example, your results.
It should be 70
And
to
the
80.
reality.
Yeah, it should be 70 to 80%. Yes. Yeah. But it's all about. I'm so sorry, we're doing something else now. Yeah. But in the end, for example, if you're talking about something, then you would just say, do you want your nose tip to be smaller or not smaller, right? Or do you want your nose lifted up or not? Or when you're talking about the breast, do you want more fullness in the upper part? This is how fullness looks. This is how roundness looks.
I tried it. I loved it.
Yeah. See,
Yeah,
and that really helps. Oh, you did the virtual reality.
Left, right. Oh, this is good.
It's a beautiful thing.
I
Yes,
love it, yeah.
it's a beautiful thing.